Traumatic brain injury. What do you think of when you hear the words? The first thought that comes to my mind is soldiers. The first time I ever heard of traumatic brain injury was in connection with the war in Iraq. Soldiers returning home with changes in their personalities, which people attributed to their experiences overseas. There were no noticeable head injuries, although there may have been other physical injuries. Are soldiers the only people who experience traumatic brain injuries? No, and they do not even represent the highest number of victims. Children under the age of 4 have that distinction, which is often the result of assault. Shaken baby syndrome in infants causes traumatic brain injury and can lead to death. Are there other victims? Yes, there are. Generally speaking, adolescents and young adults are the second most victims of traumatic brain injury, which is mostly caused by motor vehicle accidents. The other group of people most likely to be affected are those over 60 due to falls. In reality, members of the armed services are fourth in line as most likely to suffer from a traumatic brain injury. But what exactly is a traumatic brain injury, or TBI for short? The DSM-5 has specific criteria to be followed when diagnosing a TBI. The first item on the list of criteria is that the person must have evidence of a major or mild cognitive disorder. This means there is evidence of a significant cognitive decline from a previous level of performance in one or more cognitive domains: complex attention, executive function, learning and memory, language, perceptual motor, or social cognition. This is based on two things, and both must be present. The first is the concern of the individual, a knowledgeable informant, or the clinician that there has been a significant decline in cognitive function. The criterion is subjective in nature. What constitutes a significant decline? Whose standards are applied? The other criterion is a substantial impairment in cognitive performance, preferably documented by standardized neuropsychological testing or, in its absence, another quantified clinical assessment. There are several tools a clinician can use to assess for TBI. These include the Dizziness Handicap Inventory, the Epworth Sleepiness Scale, the Glasgow Coma Scale, the Neurobehavioral Symptom Inventory, and the Patient Health Questionnaire, just to name a few. Finding someone to perform and interpret neuropsychological testing is becoming more and more difficult, so it is necessary to rely on these other tests as well as your own observations of the client. A neurocognitive disorder also requires the deficit to interfere with independence in everyday activities or need assistance to complete the activities of daily living, managing medication, or paying bills. This is much easier to confirm as the client or friends or family can tell you. Often the client believes they do not need help, when in actuality people around are providing assistance to the person and they are not aware of it. The third criterion requires that the deficits do not occur exclusively in the context of delirium. This is fairly easy to assess in an interview. The last criterion is that the cognitive deficits are not better explained by another mental disorder, such as a major depressive disorder or schizophrenia. This final criterion is found in most of the diagnoses in the DSM-5. And while it should not be overlooked, a good clinician will have already looked at that possibility. Major depressive disorder can co-occur with TBI, but TBI cannot cause schizophrenia. The DSM-5 has additional specific criteria to diagnose neurocognitive disorder due to traumatic brain injury. There must be evidence of a brain injury. This is to say, the clinician must know for certain that the client has sustained an impact to the head which could have been intrusive, such as a bullet or other object that entered the skull, or concussive, which is to say, an incident which caused the brain to have rapid movement within the skull, producing injury to the brain cells. One or more of the following must be present: a loss of consciousness, post-traumatic amnesia, disorientation, confusion, or neurological signs confirmed by medical tests, such as an MRI or CT scan. Other signs which can indicate TBI are the onset of a seizure disorder where one did not exist prior to the injury, or the worsening of an existing seizure disorder, impairment of visual fields, the loss of the ability to smell, or paralysis, either partial or more extensive. These are the diagnostic criteria for a traumatic brain injury. But do you understand what a TBI is and how a person sustains one? A TBI happens when there is a violent blow or shock to the head. There are two classifications, open and closed, and they are exactly what you would expect. An open head traumatic brain injury results when the skull is fractured. This can occur as a result of domestic violence, automobile accidents, sports injuries, falls, explosions, gunshots, or combat injuries. A closed head injury is one in which the skull is not fractured. They also happen as a result of domestic violence, motor vehicle accidents, sports injuries, or falls. Anytime a person hits their head and loses consciousness, even for a few seconds, they are assessed for a TBI. What are the symptoms of a TBI? What do you look for? There are three categories of symptoms to be assessed: physical symptoms, sensory symptoms, and cognitive symptoms. Physical symptoms include a loss of consciousness or a state of being dazed, confused, or disoriented. Headache, nausea, vomiting, fatigue, or drowsiness can also be signs of a traumatic brain injury. Is your client having trouble with speech? This can manifest as slow or slurred speech, difficulty in finding words, or using inappropriate vocabulary. They can also report difficulty sleeping. Either they can't fall asleep, can't stay asleep, or sleep for prolonged periods of time. Another physical sign of a TBI is balance. Can your client walk across the office to the chair, or are they wobbly? This symptom is observable. Sensory symptoms are a little more difficult as they have to be reported, but you can always ask if they are having trouble seeing or hearing, or having a bad taste in their mouth. Often clients are embarrassed by these symptoms, so it is best to be careful when exploring these issues. As clinicians, we are trained to assess for mood changes or swings and depression and anxiety. Assessing memory or concentration is trickier, but can be done in a conversational manner. Many times, the client is unaware of the inability to concentrate or remember, and the ability to hold a conversation on a common subject will help with this assessment. A moderate to severe traumatic brain injury encompasses these same symptoms, but with more gravity. A person with a moderate to severe TBI may have profound confusion, severe agitation, become combative, or exhibit behavior that is unusual for them. Who has the highest risk for sustaining a TBI? Number 1 is children under the age of 4, generally from domestic violence, automobile accidents, or falls. Next on the list are young adults between the age of 15 and 24, where motor vehicle accidents and sports injuries are the most common causes. This makes sense when you think about it. Young adults engage in high-risk behaviors because as a natural part of growing up, this is the time in their life when they have a sense of invincibility. Third most likely to have an injury leading to a TBI are those over 60, and this is due to the increased risk of falls in this age group. Loss of balance and sudden bone fractures due to osteoporosis increase the risk of falling and hitting your head. The last group are males in any age group. Research has found that males tend to engage in riskier activities more than females in all age groups. There is no cure for a traumatic brain injury. The brain will repair itself the most in the first 30 days after injury, and slowly for the next 1 to 2 years. There is rarely improvement after 2 years. Treatment is directed to the symptomology and is discontinued when the symptom resolves. If you would like to know more about traumatic brain injury, you can visit the Mayo Clinic website, the CDC website, or the Shepherd Center website. YouTube has many videos with TBI patients and their experience. As always, in today's world, you can always just Google it.